If you're thinking about taking the FPC or CFRN exam, you definitely need to know the four different types of hypoxia. And it's not just flight stuff. It's important to know the types of hypoxia because it helps to understand what may be going on with the patient. The first type is hypoxic hypoxia. How original of a name. This is due to having a deficiency of available oxygen. So think about somebody trapped in a cave and there's not a lot of oxygen. Or maybe you're one of those weirdos who wears a leather mask with a ball gag. FPC, CFRN people, as you go to altitude, there is less gas pressure. The oxygen molecules get spaced farther apart. So there is a deficiency of available oxygen. Think about a pulmonary edema patient. They are deficient of oxygen because there is fluid filling the alveoli, so the body is lacking oxygen molecules. The next type is stagnant hypoxia. That is where blood flow gets sluggish. The stagnant hypoxia that we see all the time is due to distributive shock states. You get vasodilation. So you have an adequate blood volume, but the container is too friggin' big to nicely hold the blood volume. So blood doesn't flow well through the vasculature and it does a crap job of delivering oxygen to tissues. Also, for the FPC CFRN exam, pilots can get stagnant hypoxia when flying at G forces. Not that that's going to happen to any of us. The next type is hypemic hypoxia. This is where you have adequate oxygen, you have adequate blood volume, but there is some abnormal condition prohibiting the oxygen from attaching to hemoglobin. Anemia is the biggest cause of hypemic hypoxia. Patients with a low H&H are going to have hypemic hypoxia. Cancer patients, hypemic hypoxia. The final type that you need to know, and this is the easiest one, is histotoxic. This is the easiest one in my opinion. This is where a toxin is prohibiting the cell from utilizing oxygen. This happens with cyanide poisoning. So if you see any question about a house fire, the products of combustion, or a wife poisoning her husband with cyanide, it is going to be histotoxic hypoxia.